Hi, this is Danny with Longevity for the Long Haul. I recently was in Washington, D.C. to participate in the SOS Millions Missing. I'd like to introduce this is
Hi, I'm Brittany.
Brittany and I don't even know each other. This is our first time meeting. I went to the protest, and Brittany, did you get the chance to go to the protest?
I wasn't able to participate in DC, but I was active online, mostly on TikTok.
Oh, you're active on TikTok and you educate people on ME?
Yes, correct.
Awesome. So, how long have you had ME?
I was diagnosed in 2018.
Wow. And how did you find ME action?
That's a really good question. I believe it was, I remember connecting with them I believe it was 2019, and it would have been when Jen Brea was running everything. So I think I probably got there from watching her documentary and then kind of following the trail.
And that was actually like the first Millions Missing, right?
I don't think mine was quite the first one, but I do believe it was pretty early on. Yeah.
Yeah, I was like just getting started. And
Mhm.
for those people that don't know what Millions Missing is, do you want to fill them in or and let them know
Sure.
what you know?
Yeah. So basically it's on MECFS Awareness Day, myalgic encephalomyelitis, chronic fatigue syndrome, which we hate the word chronic or the phrase chronic fatigue syndrome, but
Hmm.
is a day of advocacy, a day of protest, a day to kind of remind everyone that there are so many people who are missing from their lives due to MECFS and now long COVID. And so when I first went to my first gathering, there were a lot of shoes laid out as well. And it was shoes with little placards or pieces of paper that said, I'm so and so. I've been missing from my life since, whatever the year was. And it basically stands as a visual for everyone to realize that these are people who were active in society before who can no longer be active now. And
Hmm.
that kind of morphed and continued into what we saw this year, which was people showing up and talking to Congress and kind of taking those extra steps.
Yeah, it was actually crazy. This is my first Millions Missing. I came to the community through long COVID and I didn't even know what ME was. But then when I went like public online, I kept on seeing ME, Spoonie. And I'm like, what does that mean? And then once I was like, oh my God, hello, that's me, you know? And if it weren't for ME Action, I wouldn't have found like Dr. Klimas, who's in Jen Brea's movie, right? And so I got active and I had lobbied in Washington prior to being sick for pediatric cancer. So this year when I went, I was just like, we have to do something. Like we have to like if we're going to be there, we might as well go visit our senators.
Yeah.
And so when I got there, everybody volunteered to like help because I was going to go meet 100 of them. And then some of the people at the protest, we divided and we conquered and we met everyone. But what was crazy was we had a bunch of photos. Can you tell them about the photos and what that was about?
Yeah, ME Action sent out they send out a toolkit on ways that you can choose to participate. And a lot of those are from home for a lot of us who aren't able to get on a plane and travel to DC because that would take so much energy and can cause significant health setbacks for a lot of people. And one of the things that they did this year, which I think was new, I don't think I've seen it since I've been doing Millions Missing, was the opportunity to submit a photograph and I think just like a couple lines about yourself. And those were going to be brought to the event. And I had no idea that those were then going to be used in conversations with Congress, which just makes it that much better.
Yeah, right. It was kind of funny how it evolved because like we went, we had the event, we saw the photos, and then I was just like, can we let's take these with us. Like, let's go. So I don't know if you know, but Senator Cassidy is the one who got RFK into office. He was a 14-13 vote. For
Okay.
me, I really wanted to go to his office, and his role that he's playing right now is instrumental in like protecting all of us Americans. And so when I went to his office, I pulled out your photo. And then I was like, oh my gosh. So my daughter asked me because I had a typical speech that I gave to everybody, right? But I really laid it on thick that day. So she's like, what just happened in there? I was like, I just let it all out. And it was funny because like a lot of people, with the Democrat, Republican, whatever, and if a lot of people don't know what we did is like me and other volunteers, we went and we visited each senator's office. And what the process is like, you meet the interns or the aides that are just sitting there waiting to receive you. And we let them know that we had protested yesterday and that we had invited them to come, but we understand they couldn't come. And that we were going to bring the information to them. And so I presented I told my story, told them I'd been disabled, told them like that I had been a pediatric oncology nurse, a lobbyist in Washington, like I used to do. And then now that I'm sick, I can no longer do, and that I'd be paying a price for going. Like today's the first day since the protest and since I was in Washington that I actually feel good. And so it was even cooler that today you called or you commented that, oh my God, that's me in the photo. I was like,
Mhm.
no way. And then I was like, this is the information on our organization, and this is what we've been doing. And said, we have myalgic encephalomyelitis, which I don't think I've ever heard in Congress them say those words. Like, I don't know, but I'd like to know. And then I said, and this is a photo of someone who wishes she could be here today. And she can't be here because she has ME. And so you should have seen the girl's look on her face. She was like, "Ooh," and I was like, and these are our mints because we are meant to be cured. Okay. And I was like, because I used to be a badass when I just like walked out the door. But it was the fun, like, it was like, yes, I was bringing some like hard, cold facts to them. But at the same time, I was like breaking the ice. And so I have an idea. I think you should be the one to write Senator Cassidy a letter and
Okay.
tell him, yeah, because he's in Louisiana. I know, you don't live in Louisiana, but it doesn't matter because the role that he plays in Congress is that he's one of he's one of the ones making the decisions about healthcare now. So, and he just paid, like I said, he's the reason why RFK got into the position that he got into. So, if you could have come, like, what would you have said to him? Like, if you were there in the office and it wasn't me, like, what would you said to Senator Cassidy?
I think my story would have been very similar. I actually have a law degree. I was admitted to practice in two different jurisdictions, so I passed two bar exams on the first try. So I was no
Hmm.
slouch. I also spent the majority of my 5-year law career representing children in court. I was minors counsel, so in dependency proceedings. And in those situations where a child was experiencing abuse or neglect, the child was appointed counsel in my state to act as counsel and guardian ad litem. And that was my job. And I had, at one point, I was representing 300 cases, like 300 cases. So I don't even know how many children, because some of those cases had siblings.
Hmm.
I was in court every day. I was in court, and then I was going to lunch, and then I was in trial, and then I was going to visit these children in their placements to check the safety of their home, to talk to them, to make sure they were okay, to get their information on what they wanted shared with the court. And then I would be able to come home and make dinner and do all of the things that the rest of us do. And when I got sick, one of the hardest symptoms to deal with, part of the post exertional malaise, but also the brain fog. My brain can't do that anymore. And I think the thing that a lot of people don't realize is that if I could, I would do that again in a heartbeat. I would go back. I would do a lot of things to be able to go back to work. And so this isn't a situation where ME patients are milking the system and making it up. And I got to tell you, trying to get through the disability process and all of that, it's no easy task. So we're not looking at a situation of a bunch of lazy people. We're looking at overachievers like lawyers and oncology nurses and doctors and so on. And that's who this illness is affecting. And by taking us all out of the working field, you're paying more. Like you're
Hmm.
having to pay more in healthcare costs, you're having to pay more in disability payments, you're losing people who are qualified.
Hmm.
And, I had to go through long-term disability to get loans forgiven. You're losing out on loan payments. I mean, if at the end of the day, what you're worried about is money, you'd be better served to research these illnesses and come up with effective treatments and get us all back to working. I mean, that would be the dream. So I think, honing in on the importance of us as individuals, but also even financially, if you want to be cold about it, like
Mhm.
we're no longer doing what we need to be doing, and our lives don't look anything like what we set out for them to look like.
Exactly. And that would have been perfect because I basically went in there and I said that all of my treatment so far has not been covered by insurance. I pay out of pocket for everything. I don't qualify for disability because it's not recognized in a way that it's easy for me to get disability. And, we would much rather be doing our jobs because I don't know about you, but I lost my identity
Hmm.
whenever
Oh,
I could no longer walk, talk, and move.
yeah. Oh, 100%. And I would I would also add that like we had these full lives. Like I had a life outside of work, and now I don't even have like my world has gotten so small, and my ability to contribute to society has gotten small, but that is not through my fault. That is a
Mhm.
failing of funding and the government and money and research and education, etc. I think I would also probably, I was just thinking about it, I would have probably also added that we do not need to reinvent the wheel on some of this research. We already know that things like graduated exercise and psychological CBT for retraining the brain are not the answer. So,
Mhm.
in pushing on, RFK Jr. and his research, my other concern is that I don't want to go backward. I don't want to go back to
100%.
when ME was called the yuppie flu or is considered psychosomatic. I don't want to reinvent the wheel. And with long COVID, we have a unique opportunity to see what happens when there's a disease onset that results then in people. I think it's last I saw, it was like 50% of the people meet the criteria for ME. We have a unique opportunity to explore that whole thing. But when we're doing that, I want to make sure that patients who have been sick for decades are included, that research doesn't, any research that is focused on long COVID needs to be extrapolated to not forget about the patients who had ME prior to COVID as well.
Yeah, what I tell people, because I'm a nurse, I'm like, well, understanding ME and the history, like it's been around for 100 years, and it's just what triggers the onset is different. And I said early on, I was like, long COVID is ME rebranded. You know what I mean? It's like you know what I mean? If it's just ridiculous. So it's the disease pathology that is happening to all of us, right? So what was I gonna say? I was gonna say something pretty good. I love that about my brain. But
Yeah, same. Oh, same.
no, right? So the other thing that I thought, like in the beginning, whenever I came across Emmy and I would start telling my story, and I feel like people with long COVID are really getting so much more attention because the volume of people that have been impacted. And I have always felt like this Emmy, like coming in and listening to the group in Emmy, you guys have so much wisdom, so much experience. You guys have experienced the same trauma without, even though it's been traumatic for us, right? For political reasons and for everything, I would say it was traumatic, period, to just have somebody not believe you, for you to go from one doctor's appointment to the next. And now, I think what I really want people to know about is the roadmap, and that they've now created a roadmap that we had written a letter and that it was going to get funded within the last administration. And now we're writing a letter to Jay Bhattacharya, who's in the position to fund that roadmap. And what does that roadmap mean to you? Like as an oncology nurse, what a roadmap is when someone gets sick and they get a diagnosis and a classification, they're given a roadmap of their treatment. So that's what it means to me. But what does a roadmap mean to you and the ME community?
I mean, I think that there's something very validating about a roadmap. Like, even if we take out the logistics of what it means, like scientifically, there's something to be said for validation as well. because I know that Bateman Horn recently released, and I don't know if you've seen it yet, with Open Medicine Foundation. They recently released like a packet of information, and I don't remember what they call it. I think it's a clinician guide or something. But it's a packet of information that basically says here are the criteria for diagnoses. Here are some of the let me try that again. So this clinician guide basically says, here are the criteria for diagnoses, here are the comorbidities, here are some of the treatments that are available for these comorbidities, whether they're FDA approved or not, whether they're going to be covered by insurance or not. But here it is. And as someone who's been sick for at least 7 years now, I looked at it and my first thought was, this is the thing of beauty, not just because it lists out treatments, but because it's validating to have something in your hands to be able to hand to a provider and say, this is what I'm talking about. This is real. I'm sick. It's been studied. These are the comorbidities. These are the guidelines. So that even if you meet a new doctor, we limit that gaslighting potential. So I think
Uh-huh.
a roadmap and a general course of action means, one, that we're getting treatments and we're hopefully getting people back to a better baseline or ideally cured. But it also means validation and
Creating evidence,
hopefully
right?
creating evidence, right, to be able to have a provider or multiple providers take it seriously and say, oh crap, this is actually a thing, instead of this vague illness that has been forgotten so many times.
Yeah, I feel like I've been speed dating doctors in slow motion. You know what I mean? And it's just like, you wish like this wasn't your experience and that you could basically walk in there and give them a place to start. I mean, some doctors, won't care and are not interested. If they can't treat you, they don't want to touch you. And then there will be one doctor that is like willing to listen, willing to try anything, but has limitations to what they know and what they can do. But a roadmap actually gives them, you know, a direction that they can head in. Like the more we know about ourselves, about our disease, and as our community grows, it's great that, if we have a roadmap, this gives physicians direction, consistency, information, and any action has played a pivotal role in that. And for me, I found a home at ME that I have not known, even within the long COVID community, because it feels very like, I don't know. I want to say the word that I want to say, it feels aggressive. It feels like volatile. Probably it feels volatile to be in the long COVID community versus when I met the ME community, it felt like you guys already have been there, done that, understand the barriers, understand the frustration. And it's just like sometimes I didn't even feel like I fit in with ME just because I felt like my disease was getting more attention than your disease, right? But as a nurse, I know like we all need help and we all need support. And that has changed since I've been part of ME Action because I've met more people like you that are educated and understand and could basically tell me far more about my life and what it's going to look like and how to cope, instead of being lonely. So, like, I thank all of you that have been there, done that. And I never get the chance to thank people like you. So, thank you. I really,
And I appreciate it. And obviously you're welcome, but also, I think from the flip side, like it's so unfortunate that we had this onslaught of COVID long haulers. And I feel devastated for you that our research wasn't enough and wasn't there to be able to kind of help prevent you guys from getting worse, or prevent, to help you more than it has, that we're not in a better place for you to land as far as the research and the education and the knowledge. There's certainly patient knowledge, but on the medical side of things, right?
yeah,
And so I have this like this if it was it's like it's so unfortunate that this is what it's taking to bring attention, and your sacrifice, is ultimately going to work its way back to benefit us. So it's like this conflicted feeling, because it's like I'm grateful that there's attention on it again, but it's awful that this is what it took to get there.
yeah. Like, you gave me goosebumps when you said that because it's just like, if ME had been recognized sooner and steps were taken to treat it, then if they had taken it seriously and they had treated it when this happened, they would have been better prepared to support people with retroviral illnesses. And I mean, you make a very, very good point. And yeah, I mean, it just that hits differently for an oncology nurse because you're just like, wow, like, it's like I used to always say about children that would pass away is that they were born too soon, because the
Yeah.
cure is coming, the cure is coming.
Mhm.
But I do think collectively, if we work together, that we can help everyone, And I think especially with this tide turning, it's like, I don't know how much I want to say about it, but I'm going to say it, but I might cut it out. Um, about like first it was like long covid was getting the attention and being recognized and me was getting some but not all, right? So now because me is considered a chronic illness, now as a community people could drop their long covid and they could highlight their me and get treated like it's an opportunity to now still keep going, not stopping, but working within what the goals are of the administration. You know what I'm saying?
I Yeah, I think it can be a benefit. I also worry about it being a detriment. So I think there's a fine line there because ME has all of these negative associations with it, and because it has such a tumultuous history that it has,
Right.
leaning on ME could actually prove to be detrimental because they're more likely to say, well, if that's what it is, they've already dismissed us. So I think I know when COVID first started, I was one of the people screaming from the rooftops, please rest. Please just stop doing things until you're back to your baseline. Please do not push through. Please stop because
Yeah.
you're going to end up in a situation where you could end up with a post-viral illness of some sort, whether that looks like ME or whether that looks like, a variant of that. And I think I was kind of conflicted at the beginning because there was this distinction between long haul and ME, and I gave it so much thought. Like, is it more beneficial that they're treating it as something new, and can we kind of ride those coattails as far as research?
Both.
Yeah, exactly. And the end result is that it's really both. And I think there's kind of this middle ground that we're hopefully finding as time goes on. And which is why I appreciate with like your advocacy and talking to Congress and all of that, that both things are mentioned and that in that hearing, me was mentioned by name because you're right. I don't think I've heard it mentioned before.
I know. And I was a little salty when I was in there. I was just like I was really because I just feel like I think as a community we should be leaning on him because he's the one who like allowed him to be in this position. And so I want to put friendly energy in his direction. I want him to like us. I want him to care. And as a clinician, he was already fighting for long COVID. And then the fact when he said myalgic encephalomyelitis, I was like, what? And then I went and I was like, I was just there yesterday. And then I went and got the picture that I took. I was holding a Whole Foods bag when I was holding your picture. I was like, dang it. But then I cropped it out, but then the cropping, you could see your photo. So I was like, that worked out. It was meant to be. Like,
It was so funny because I didn't notice it was me. I saw the post and I was like, oh my gosh, that's so cool. Oh, look, there's a photo. And I didn't even register it. And then Emmy Action sent out their kind of like millions missing recap email this morning. And I was like, wait a second. Like, that's crazy that it was my photo at that office. And it's great because from home, you feel like sometimes you're shouting into an echo chamber and a void. Because yeah, you know that I don't feel well. This isn't news to you. I don't need to educate you on ME, unless it's something like you want help with symptoms or something, but like you already know. And so I find too that like on some of the social media platforms, the algorithms are not kind. So on TikTok, for example, when I use the hashtag millions missing, my video doesn't gain as much traction as if I just use my regular hashtags. So in years past, I've always posted some sort of video for millions missing, and it usually gets very limited coverage and very limited views. And so this opportunity to be literally seen made a huge difference. Like, I was crying this morning.
Yeah.
It made a huge difference to not feel so invisible. And I
Hmm.
think this year too, there wasn't a big art installation or anything like that. And so I think these photos making a difference really brought it home, and
Yeah.
put an actual face. And I know, like, I've seen that picture. The dark circles tell all, and that's why I sent
Huh?
it, because I was like, I look.
Yeah. But when I said to them, I was like, and she can't be here. She wants to be, but she cannot be here to advocate for herself, you know? And they were just
Mhm.
like that, you know? But then I was like, but we're meant to be cured. So hey, don't forget about us, you know?
Exactly.
And then Todd
Yeah.
Young, I went into his office too, and he said something to RFK that day too. So I was like, this is amazing. And I think the timing of it and the hearings and everything, and the fact that you're willing to send your photo and you're willing to like do that. And I think I'm an extension of you. You are an extension of me. And we will get better together. We can get better together. And if you could, say something to people who are living with ME, newly diagnosed with long COVID. I already know the best piece of advice that I got from the ME community, and it was not to push. And so I feel like I can thank you guys for that advice, because not pushing and like pacing has helped me preserve. Like I try to maintain, manage, and then modify, and then, maximize what I can do. Like that's like my whole goal. But if you could give somebody with ME or long COVID advice, what would you tell them?
I think obviously the first one is pacing, like you talked about, but if we're talking about something else, I think trust your gut. You're not crazy. I believe you. Your experience is valid. And then with that, it's very easy to lose yourself quickly. You lose your career. My ex-husband left me shortly after I got sick. You lose
Uh,
loved ones, you lose friends, you lose family. Keep an eye on the ones who stay, but also know that there's a community here, and try to find the things that make you you, that you're still able to do, even if it's in a different way. So for example, I have a minor in theater, and I used to sing all the time, and I would go to plays and whatever. And so now when I feel well enough, I might go see a show, or I might sing on TikTok for 1 minute, and that still can be exhausting, and that may still be too much for a lot of people, but find things that are kind of within your world and within your pacing that are crucial to who you are, so that you can kind of claw back a little bit of that, a little bit of your person, so you don't feel so
mhm.
much like a carbon copy.
Yeah. And I think this conversation has been amazing. I just really want to thank you for just being here. I definitely want to thank ME Action for like bringing us together. And I think more importantly, what I learned today when you respond to my Instagram post and when we're just connecting on this phone call is that we're not alone, right? We have each other, and now we have found a way to be seen and like this isn't the end. We're gonna keep going, and you'll follow up with an email with Congress, and then maybe next year you might be there. Who knows? We never know, right? So thank you for being on this episode with me and sharing your story. And thank you so much. I really appreciate it.
Well, and thank you. Thank you so much for reaching back out to me and for giving me the opportunity to kind of expand on my story and my background and kind of how I got where I am, and, talking to you about how it looks like moving forward. And I'll definitely send a follow-up email.
Oh yeah,
Oh yeah. And I'll include the same picture so we get a little of that.
that's
But
right.
yeah, like, hey, that girl, like that, hi, that was me. Yeah. But I think that, it's been a wonderful opportunity. Yes, again, I think that the two communities need to remember that we're on the same side. I feel like sometimes there's some division amongst
Yeah,
the two communities, and we're not at odds. We both want the same thing. We
Yep.
both want to not be forgotten, and we both would like to get back to, to our lives.
Yeah. And we're just gonna get better together. And this is longevity for the long haul. And thank you again for tuning in and follow for more, share and like and comment so we can create a stronger community together. Thanks again.
Thanks.